Hello, bonjour, bienvenue, and thank you for joining me for this brief postscript to the CASEM conference, that's the Canadian Association of Sport and Exercise Medicine, in Ottawa just last week. It was a great conference. It was superbly organised, wonderful speakers, and a tremendous showcase for Canadian sports medicine. For CMAJ2, it was very interesting because the first session on the very first day discussed some of the highlighted papers of the last year, and the very first paper discussed was a paper from CMAJ. One of the topics that came up for discussion on a number of occasions during the conference was concussion. I particularly enjoyed Scott Delaney's paper, which addressed the question, should my child play contact sport? That's quite relevant to a paper we've recently published in CMAJ. In fact, it's just gone up on the website. Some of you may have heard me say that it's very important for sport and exercise medicine to remain in mainstream medicine. One of the ways we can do that is to enter in discussion and dialogue when important issues come up. We can do that through CMAJ, and what we'd like to do is to encourage you to respond to articles that appear in CMAJ, for example that meniscus injury or even this piece on concussion. And you can do that with a rapid response on the CMAJ website. In addition to the standard research papers on CMAJ, we're very keen to develop a multimedia presence that includes podcasts and short videos like this. We also have a very active blog site. You can take a look at the CMAJ blog site for 2 reports on this conference. Thank you very much for joining me. I hope you find this interesting. I hope you'll go to the papers on CMAJ, and I hope you have a look at the blog site. Until we meet again, au revoir.